Dr. Khan, are there any publications supporting breast implant illness?
So this is a very good question. So it's not only I, but you have the first and foremost, look at the FDA warnings, the black box warning. Number two, look at the manufacturer's warnings themselves of the product that, for example, Mentor is selling itself. I want each and every one of my patients, significant others, to look into that black box warning and the manufacturer's warnings themselves. Now, there's very good data out there. We have this research paper that is actually a study, breast implant illness treatment using total capsulectomy and implant removal. This is Dr. Steven Metzinger, and he published basically that breast implant, and we'll have this on my Facebook page and my YouTube. Breast implant illness is an extramammary systemic symptoms that are caused by breast implants. And what he did was he looked at a total of 200 patients who fulfilled inclusion criteria, where the average age was 45 years and the patient has had implants. And what he did was the patients presented with breast implant illness. 96% reported improved or complete resolution of their systemic symptoms after implant removal and total capsulectomy. So let me say this again. So he removed the implants and total capsulectomy was done. And these are his patients, 200 patients that he followed from 2016 to 2020. And then he showed, his study shows, and this is his 200 patients, where implant removal with capsulectomy drastically improves BII, breast implant illness symptoms. Further large prospective cohort studies are needed to better understand this entity. So as you can see clearly, this is a paper, and we'll certainly have this up, where the surgeon is saying that total capsulectomy needs to be done for symptomatic improvement and recovery. So it is incomplete just to remove the implant. So I'm going to hopefully reach out to Dr. Metzinger, and I will hopefully do a Facebook Live with him, question answer, so I can learn from him. And again, we are thinking alike. The take-home message is what? The implant needs to be removed. The capsule absolutely needs to be removed. Total capsulectomy, and any of that inflamed tissue around, such that when the patient is done with her surgery, she is at peace, she has the peace of mind, she's content that all of that capsule was removed and all of it was tested, so that there is no mention or suggestions or fear of any surprises later on, such as BIA, ALCL, BIA, SCC, which is very rare of rare but underreported. And this is where the plastic surgeon has to be complete in order to do the surgery, number one, and number two, in order to completely confirm that there is no abnormality in that capsule that was removed. This is Dr. Khan, Executive Plastic Surgery.